Hi, this is Don Campbell, your English teacher again. Today is part 6. This is part 6, the last part of our Picture Dictionary color handout videos. So we're going to go to pages 86 and 87. Pages 86 and 87. Page 86 is about starts about a hospital. I'm going to share screen now. And now you can see pages 86 and 87. So we're looking at page 86. At the top, it says a hospital. Hospital staff. Hospital staff, that means people who work in the hospital. Number 1 is obstetrician. Obstetrician. Obstetrician is a doctor for pregnant women, doctor for women who will have a baby. Number 2 is internist. Internist. They look at a lot of problems inside you, so internist. Number 3 is cardiologist. Cardiologist. A cardiologist is a heart doctor. Number 4 is pediatrician. Pediatrician. Pediatrician is a doctor for children. Number 5, radiologist. Radiologist. They know about x-rays. They can understand things about your health when they look at an x-ray. Number 6, psychiatrist. Psychiatrist. A psychiatrist or a psychologist or counselor, they can all help you and talk to you when you're feeling very sad, when you have problems with mental health, Number 7 is ophthalmologist. Ophthalmologist, they help with special problems with your eyes. Regular eye doctor is optometrist. Ophthalmologist is for special eye problems. Number 8 is x-ray technician. X-ray technician, that's the person who takes the x-rays. Okay, we're looking at the patient's room in a hospital. Number 9 is the bed table. Bed table. Number 10, call button. Call button. If you feel very bad, you can press the call button and a nurse will come. Number 11, hospital bed. Hospital bed. Number 12, bed control. Bed control. They can move the bed up and down different ways. Number 13, bedpan. Bedpan. If you can't walk to the toilet, to the washroom, you can use the bedpan. They keep it under the bed. Number 14, medical waste disposal. Medical waste disposal. They put needles, syringes after they use them, or sometimes gloves after they use them for special garbage to be safe. Number 15, hospital gown. Hospital gown. People don't like to wear them. Number 16, lab technician. Lab technician. This man is taking a blood sample so they can test the patient's blood, check for problems with the blood. Number 17, blood work or blood test. They're checking for things in the blood. Blood work or blood test. At the bottom of page 86, it says more vocabulary, more words. Nurse practitioner is one kind of nurse. Specialist is a doctor who does only special things, not everything. For example, a cardiologist is a specialist only for the heart, not for everything. Gynecologist. Gynecologist is a specialist only for women. And a midwife, sometimes is someone who helps women who are having a baby, when they are having the baby, when the baby is coming out, childbirth. Okay, let's go to page 87. At the top it says a hospital and nurses station. This is where the nurses are working some of the time. Number 18 is orderly. An orderly is not a nurse. The orderly will move you to different places and help you sometimes. But the orderly is not a nurse, not a doctor. Number 19 is a volunteer. They do something for free. The hospital does not pay them. They're not a doctor or nurse. Okay. Number 20, medical charts. Medical charts. That has information about each person who is sick in the hospital, each patient. Number 21, vital signs monitor. They can see on their computer, the nurses, about your information when you are in your hospital room. Number 22, RN, registered nurse. Registered nurse, that's a high-level nurse. Number 24 is medication tray. Medication tray. So medication is the same as medicine. Number 24, RNA, registered nursing assistant. Registered nursing assistant. So registered nurse is a little bit higher, registered nursing assistant is a little bit lower, but they both know a lot. Number 25, dietitian. Dietitian, maybe there's special things you need about food. Okay, emergency room, like when there is a car accident or someone has a heart attack, when there's an emergency and people come in an ambulance. So number 26, paramedic. Paramedic. They have some training about medicine, but they are not doctors, but they can help you. They know a lot. Sometimes they call them EMT, EMT, emergency medical technician, or paramedic. They can help you in the ambulance when the ambulance is driving to the hospital. Next one is 27, IV, IV, intravenous drip. That's when they're putting something in your body. Sometimes it's water with a little bit of salt, sometimes it's medicine. Number 28, stretcher or gurney. Stretcher or gurney, that's for moving the patient, moving the person who is sick. Okay, operating room, that's where they do an operation or surgery, where they cut you to help you. So number 29, surgical nurse. Surgical nurse helps with the surgery or the operation. Number 30, surgeon. Surgeon is a special doctor who does operations or surgery. 31, surgical cap, they wear on their head. 32, surgical gown, surgical gown. Surgical means about surgery or for surgery. Number 33, latex gloves to be safe. Number 34, operating table, operating table. Number 35, anesthetist, anesthetist. They give you the anesthetic so you sleep when they are doing the big surgery. Anesthetist or sometimes anesthesiologist, anesthetist or anesthesiologist. Two words that mean the same thing. At the bottom of page 87, it says, practice asking for the hospital staff. Example, please get the nurse. I have a question for her. So that nurse is a woman, she, her. If the nurse is a man, please get the nurse. I have a question for him. The next one, where's the anesthetist? I need to talk to her. So that anesthetist is a woman. If the anesthetist is a man, where's the anesthetist? I need to talk to him. And then I'm looking for the lab technician. Have you seen him? So this lab technician is a man, he, him. If the lab technician is a woman, I'm looking for the lab technician. Have you seen her? Okay, that's the end of part 6, and that's the last part. So thank you very much.